The question is that the bill be agreed to in principle. Yes, Ms. Carrick.
Thank you, Speaker. I rise to talk about the budget and the Supplementary Appropriation Bill. I speak in my role as an independent member for Murrumbidgee, not as the Deputy Chair of the Public Accounts and Administration Committee. I am new to the ACT budget framework. However, I have found it frustrating to navigate due to the difficulty in finding meaningful financial information about the actual spend against budgets because of the following reasons. The appropriations are set at the directorate level. The budget outlook does have budgeted financial statements and a good split of revenue and expenses, but that is the last you see of those expenses. The directorate budgets are at output level. These outputs are scattered over the directorate's documents, and it is time-consuming to find the information. It would be handy to have one document with all the outcomes. The quarterly reports are sets of financial statements with no notes to explain the figures, and there is a table of expenditure against budgets at the very high directorate level. There are quarterly dashboards which provide high-level activity and comparisons to the same period the year before, and that would be good if it was broken down to a lower level. Annual reports provide actuals and variances against the budgeted outcomes. There needs to be simpler reporting against activities to monitor and manage the pressures on the budget. The main output in the Health Directorate is at a very high level, 1.1 for acute services being $1.7 billion. The Directorate manages this output at a lower level of detail and alerts Treasury if there are any concerns. Reporting at this high level makes it very difficult for oversight of where pressures are emerging in the budget. To get more meaningful information, it would be best to track expenditure and report variances to budget against the general government sector expenses by function shown on page 285 of the 24-25 budget outlook. The appropriation bill is for $388 million, with health receiving $330 million to keep the health system going. This is important because health funding was expected to run out on 7th of May this year. In addition, $24 million is for Community Services Directorate for out-of-home care, $20 million to the Chief Minister's Directorate for a central funding pool, nearly $10 million for the Justice and Safety Directorate for police salaries, and nearly $4 million for more Treasurer's advance. Interestingly, this is a story about cash flow problems due to the poor budget forecasting in health services. Because of the $330 million appropriated for health, $159 million had already been provided to Canberra Health Services earlier this year. $80 million from the ACT Health Directorate, which will be reimbursed to them through the new money in the bill, and $79 million from the Treasurer's advance, which will be returned to the Treasurer from the $250 million appropriation to the local health network. The primary reason for the additional requirement for health funding was the increase in demand for services of around 85,000 additional patients, which required supplementary staffing, including agency nursing, visiting medical officers and locums. The increase in demand from the opening of new capacity at the emergency building at Canberra Hospital does not appear to be factored into the budgets, and increases in daily activity apparently did not trigger discussions about the impact on costs and the available budget funding. Because there was no monthly reporting in July and August 2024, and there is a lag in receiving invoices, the extent of the problem was not known until after the quarterly report and the election. The increasing activity did not lead to consideration about the impact on the forward estimates in the budget. The Minister has said she needs to work out how to manage it. I assume that means how they will reduce costs so it does not increase the deficit, debt and interest payments in the forward estimates by an alarming amount. This leads to doubts about the current budget forecasts, particularly the surpluses that are shown in 26-27 and 27-28. In the budget review released in February 2025, trends in demand for health services should have been forecast, given that the Canberra Health Services had already borrowed $80 million from the Health Directorate and $79 million from the Treasurer's advance. It is not good for people to doubt the robustness of the underpinning assumptions of the budget numbers. The government needs to provide better reporting around the budget for the opposition and the crossbench to be able to do their job in the Assembly, to scrutinise decisions and hold the government to account. We need reports that show the expected demand and the actual demand with variance explanations more regularly. Forward estimates that include forecasts of expenditure for health service, for additional health demand, explanations of the underpinning assumptions behind the budget estimates. The additional appropriations have led to an increase in the deficit to almost $1 billion. From the 24-25 budget, the deficit has increased from $624 million to $972 million, a huge 56% increase. This is leading to increasing debt and interest payments. By 2027-28, the territory borrowings will be $19.8 billion and the interest expense will be $886 million. While the government says that it aims for a balanced budget, it has not achieved surpluses for many years. Debt is being used for both assets and day-to-day cash flow requirements for the directorates. $886 million in interest expense is a very large amount of money when services such as respite care at Burrangeri are being closed and we cannot get replacement social infrastructure in our area. While the government believes that young people should also contribute to paying off the debt in the future because they are using the hospital, inequality also comes from the lack of investment in our community sector and the lost opportunity for investment in social infrastructure and services now, to provide places for us to meet and to be active, which is good for physical and mental health. We want these places to give us a sense of belonging to our community for the children that live in our area now. That is better than spending hundreds of millions of dollars on interests. Well, I believe there is a lack of transparency in explaining the underpinning assumptions of the budget forecast and in the reporting of health services activity. I believe the Directorate and the Treasury are better at forecasting trends in health activity than they let us know. They knew that the budget was not going to be enough for the year, and I am sure that they know that the forecasts on current trends are also too low in the future years. Notwithstanding this, we need to ensure health services continue to be delivered for the rest of the 24-25 financial year. Thank you.